Hi, I'm Josh Kornbluth. I'm a senior fellow at the Global Brain Health Institute, based at UCSF's Memory and Aging Center. I have the pleasure of knowing Mollie Rose, a wonderful instructor and teacher of Pilates, who is also a senior fellow at GBHI. I'm here on UCSF's campus, and Mollie is going to talk to me and you about posture and movement, and she's going to show us things we can all do that will greatly improve our quality of life. Mollie Rose, I get to talk to you. This is one of my favorite things. You always blow my mind. I have to confess that when I heard that we were getting this new fellow at the Global Brain Health Institute who was a Pilates instructor, I had certain images. And my images around Pilates tended to have to do with really upright posture, like having just a super straight posture and not deviating from the posture, and people with incredibly powerful tummies that were super flat. And it turns out that I was wrong about all that.
You would not be alone in those misconceptions.
Yeah.
I think that most people have a very similar idea, not just of Pilates, but of exercise. That exercise is this very strong, gotta do it thing. Yeah. And it can be. And there's nothing wrong with pushing it cardiovascularly. Aerobic exercise is an absolutely beautiful thing. It's very important for the health of our heart. But Pilates has this really special niche in the fact that it brings the mind into the work. Exercise shouldn't be something that you have to recover from. Exercise should be something that you maybe enjoy doing. That's a maybe, but definitely something that feels good while you're doing it, and most definitely when you are finished.
Right.
So what we're going to be looking at today isn't necessarily how to exercise better, but how to move about the room in a healthier way, in a way that feels more supportive, in a way that allows you to retain your independence for much longer.
And this is stuff that we can all do, stuff we don't need a gym membership to do, that we can just do around the house, we can do at work, we can do it in our lives. It doesn't involve getting any expensive equipment or anything like that.
Or even changing your clothes.
We're going to learn, I think, a different way of thinking about posture, of thinking about alignment. Something that's going to be very crucial in what we're going to be doing has to do with our pelvis.
The first thing that we're going to be doing is locating the pelvis.
I have a rough idea of where my pelvis is, but the way you're putting this suggests that maybe I have a few things to learn about that.
Should we go find out?
Let's find out.
So, finding where the pelvis is at in your body, in space, is a trickier than it sounds task. Because what is the pelvis? Do you know what the pelvis is?
No. I'm having images of Elvis Presley, which I know dates me.
I mean, I can sway my hips a little bit from side to side. But that's the key right here. The pelvis is related to the hips. The pelvis is our center of gravity. Being upright, balancing on our feet, we have this big block of a core that we need to be able to move from one space to the other, whether it's through, walking, sitting, getting into bed, getting into a car. We need to be able to manipulate our body through space. One of the primary issues we see, whether it's with posture or whether it's with an inability to continue forward with the sports or other activities that you used to love, is this instability of the pelvis that leads to all kinds of issues: back pain, knee pain, foot pain. Because the pelvis, when we were quadrupeds, was horizontal, and now it is vertical. It's upright. The pelvis is associated with our hips. So it's a little bit of a trick question, Josh, but I'm just going to throw you into this. Okay. Can you go ahead and place your hands on your hips?
Okay.
It's not a trick question, I promise.
I'm sensing it is a trick question,
it's a little bit of a trick question.
Have I succeeded?
Your hands are not on your hips, but your hands are on this pelvis thing. So the pelvis is this big bony structure that connects the spine to the legs.
Okay.
Our hips are at the bottom of our pelvis. So our hip is where the leg connects into the pelvis. So in order to find the hips, what you're going to do is keep your hands exactly where they're at.
Okay.
But then go ahead and push your pelvis, since we can call it that, to one side.
Okay.
Perfect. Okay, now since you chose left, we're gonna take your right hand and you're gonna run it down the side, I'm gonna use that word again, pelvis, until you hit a little ledge.
There is a kind of ledge there.
Kind of ledge, it kind of stops there.
This ledge, has it been there like my whole life?
Unfortunately, yes.
Okay, cool.
Or maybe fortunately, it's good to have legs. So what you just hit was your leg bone.
Okay.
Okay?
All right.
The leg bone, where that attaches to the pelvis.
Yes.
That's your hip.
This is my hip.
That's your hip.
Okay.
Okay? So if we bring the other hand down, go ahead and take your pelvis over to the other side so that your left hand can say hello to the left hip joint. It's a little further down than that. You're in your pocket.
Oh, okay.
Yeah, so you have to get those fingers out of the pocket in order to find the hip.
It's so weird because it sounds so simple, but it's like discovering myself or something, discovering some like fundamental aspect of me. So this is, finding this is like a crucial step to figuring out how to feel better and move better?
Correct.
Okay, and I'm also really enjoying feeling my hip bones hinge.
It's really fun learning about our body because now that you know where that hip joint actually is, when someone says that they're having hip pain or hip issues, right? We have a place that we can go towards. And it's not up here. This is more spine related. This is another area of the body. The hips are where the leg comes to meet the body.
This is kind of a starting place.
Exactly. So as those hip bones move, you'll be able to dance, sit, do all of those fun things, or maybe just get out of bed and do all of those meaningful things without pulling on your back, without pulling on your neck, without pulling on the knee.
Awesome. Great start.
I study dementia prevention, so I try to figure out what are the behaviors and biology that prevent dementia and how do we capture them and bottle them really ultimately for all of us as we age into the future.
What are the benefits of movement on brain health?
Physical activity has some of the strongest data at this point. We see that there's about 30 to 80% reduced risk of dementia in adults that move.
Those are huge numbers. Please go on.
And it seems like the biggest effect sizes actually are in midlife. There seems to be this critical window where we see a really large effect, and people who are more fit in midlife tend to have even a larger reduced risk of dementia later in life.
And what would we consider midlife?
Those studies look between 40s to 60s.
And that's like, so that can be moving about, that can be gardening, that can be going for a walk, it can be getting up and shaking things out.
A whole range of things. And this is one of the challenges in the field, is that we study physical activity through lots of different ways. And I think we still need to figure out exactly which movements are most potent for brain health. But in general, we see a dose-dependent response. The more you move, the more we see a benefit in terms of cognitive and brain structure and function. What I say to my patients is every movement counts when it comes to brain health.
Okay, so I'm sitting.
I don't know about you, but I spend a lot of my day sitting.
I seem like I'm a man of action. But
hey, we saw you ride in here on your bike.
That's true, and sometimes I am. I find myself sitting a lot, sometimes with some discomfort given my back problems. So I'm really excited and interested to hear about how I may or may not be aligning myself properly.
Nothing that we do should cause pain when done correctly. Pain is a body's indicator to us that something is not quite right. So your normal reaction then, I'm not doing something right, okay, maybe it's called slouching, I do it too. What would be your correction for the slouch?
I'm going to sit up straight like this and then sit as straight as I can. So this is me.
And how comfortable is that?
Can't you tell, Mollie? It's incredibly comfortable. What are you talking about?
The fact that you stopped breathing, the fact that you've literally gripped onto your
totally
knees.
Relaxed. What are you talking about? No,
It's terrible.
It's terrible, and then I just like that. I go back worse, and then I'm like, oh, and now I feel like a failure.
So knowing where your pelvis is at in space is going to help gravity help you sit better. Because sitting doesn't have to be an active activity. In fact, it shouldn't be an active activity. As you just felt, in order to sit up like that, that took way too much. And for the amount of time that we all said sitting, if we had to exercise that much for the duration, we would all be even more exhausted at the end of the day than we already are.
No, it's not sustainable.
Right now, would you say that you're sitting on your legs on your hips or on your pelvis?
Okay.
Or even on your back. What part of your body do you feel like is bearing the most of your weight?
Well, my middle to lower part of my back sort of pushing into the back
Mm-hmm.
of the couch here. And then I don't know, I guess, I don't know what these things are, but I guess it's kind of around where I just learned my hips are.
Yeah, so the hips are in contact with something, but there's also a lot of weight further back up your spine.
That's what it feels like. It feels like my hips are sort of like the front part of the contact, and then everything's just sort of oozing back from there. Yeah.
What an accurate description.
Yeah.
So what is happening right now in this slouch position is your pelvis is rolled backwards. But that roll back of the pelvis means that your hips are way out in front of you and your spine is way behind you. So gravity is hitting you at all of these very challenging angles.
Right.
You are correct in wanting your spine to be upright because
Yeah.
when our spine is upright, gravity doesn't stress it out. So what you're going to do here is you're going to roll your pelvis forward, which is to say you're going to stop sitting on your back and you're going to start sitting on your seat or on your hips, as we were calling them.
So I'm rotating.
There you go.
Okay.
There you go. Now the other thing that you're going to have to do is scoot forward a little bit.
Okay.
Okay? There we go.
That sort of allows me, that just became much more comfortable.
Yes. So what that allowed you to do is sit on your hips.
Right.
We call it a bunch of different things, right? Is to sit on your legs. That's the reason that we moved you forward, because in that at the back of the chair position, your legs weren't really available to you, meaning your hips weren't really available to you. So we had to move you forward to where your hips could support you. This is a somewhat comfortable position, but again, if you're sitting here for many, many, many hours, even this takes some strength, it takes some muscle activation in order to maintain. That's where the fun, I think it's fun, I love pillows, comes in. So if we place this pillow, and you are maybe a little bit too far away to enjoy what I just did for you, so scoot
I
back
was aware that you were
just
putting a
little
pillow
bit.
there, but I wasn't.
Oh, thank you for making the room.
Oh.
These pillows are called lumbar support pillows for a reason. They support our low back, otherwise known as our lumbar spine. And this allows you to keep that tilt of your pelvis without you having to use all of the muscles that it may take in order to be there.
It's relief, and it feels right.
Most couches have a pillow somewhere.
Okay.
And if they don't have a pillow, most homes have a blanket that you can roll up, have a sweatshirt that you can roll up. You can even take a sweatshirt off that you're wearing. You don't have to get off the couch in order to make that happen. But providing a little bit of support behind your back so that your pelvis can be in this orientation instead of that slouching orientation will dramatically change how you feel after a long sit. We all sit a lot, and that's okay. Sitting isn't a bad thing, but being in that icky orientation is not optimal.
Now that you've helped me locate where my hips are, when I'm visualizing and now feeling where they are and where they are actually touching the couch, I can arrange myself consciously so that it is my hips and not other parts of me that are holding me up. That it's my hips that are at the foundation of the sitting position for me, and then it's going up into gravity from there.
One of the most challenging things that we can do in the day-to-day is change levels. Particularly, we already talked about this, we spend a lot of time sitting, so once we've sat for however long we've sat for, the challenge is how do we get back up? Particularly if, as you are right now, you're pretty cozy back there in the back of the chair.
Very comfortable.
What we're gonna talk about next is how one might change levels. Changing levels is something that you hear all over the place. The ability to change level is something that definitely keeps our independence or ability to live on our own possible.
And that changing level from sitting to standing, or from lying down to sitting, etc. Or going the other directions.
Exactly. We always have to reverse it, but we'll get there when we get there.
Okay, cool, yeah.
So 2 simple steps to help us stay in line with gravity and not get pushed around with it include scooting to the front of the chair. So go ahead and scoot in any way you need to, all the way to the front of the chair.
Okay, so I am scooting. I have scooted. I'm now on the edge of the chair.
Scooted effectively.
I'm on the edge.
The next piece is then bringing your feet as close underneath your pelvis as they will go.
Okay.
Okay. So now what we've done here is we've brought your feet as underneath your pelvis and hips as they will go. So we are almost in a line, almost ready to stand. The last piece is to just make that happen. Go ahead and bring yourself up to a standing position.
Okay.
How's that feel?
It felt good. It felt very clean, very clear, very simple,
Exactly.
very natural.
Natural and interesting word though, because I mean, of course you had to think about it, right?
That's
You
true.
had to do these things.
It wasn't what I would have done if you hadn't have instructed me to.
Exactly.
So it wasn't natural in that sense, in that I wouldn't have naturally done it. But doing it feels like maybe to say as nature might have intended.
If you are doing something well, if you are doing something in alignment with good posture, it has this very settling sensation to it, like of it being right. Maybe
I
foreign,
was just about
maybe
to say
different.
that. I was going to say, it feels right.
Yes.
You know, and that's quite a thing. Just from a simple act and a simple adjustment.
And you can do that no matter what kind of a chair or bed or toilet seat that you are moving to and from. Feet coming a little bit more underneath you, you coming a little bit more forward over your feet allows you to stand up with gravity instead of gravity pushing against you.
Great, I feel it.
So just like there's a way to sit with, quote, good posture, quote, good ease, there's a way to stand in that way that you found when you stood up, regardless of how you got there. One of the easiest ways to make that happen is super simple.
Okay.
You just bend your legs, okay? And when you bend your legs, if your hands were anywhere on your body, go ahead and take them out of the pockets, go ahead and take them off your chest, and keep the legs bent. And what I want you to notice when the swaying stops is how heavy you are on your feet.
I have to say, it's really noticeable that I feel like almost a power, like my connection to the floor, to the ground, to the earth. Yeah, no, it's like being plugged into something.
Plugged in is a wonderful way to think about that.
And it's just like all I did was like kind of bend my knees. But also being in alignment here.
So, I mean, you're getting exactly where we're going, right?
Yeah.
Bending the legs, what that does is it brings your hips over your feet. Whereas before, when you were standing off it doesn't matter, right, left, forward, or back, you were off kilter. So we bend the legs and that pulls, no matter where your pelvis happened to live in that moment, back over your feet. So now your job to try to come up to that more balanced standing position is to think about straightening your legs without losing any of that downward pull, that downward plugged in connection to the ground. What you will find is that the legs aren't going to want to straighten all the way, and that's totally fine.
Okay.
Right? Because if the legs straighten all the way, that's most likely going to pop you off into wherever your habitual place is.
So I'll do that now. Okay, so I'm just straightening my legs a little bit.
Strengthening them too.
And strengthening
I mean, it's a
them.
dual.
Yeah, I feel different from the way I used to feel standing.
Yeah.
And I maintained the same powerful feeling from when my knees were bent, even when my knees are almost totally straight now.
So this is something that we want to be aware of. Just like when I had you seated and it was like core work, it was an exercise. Standing like this is not how you always need to stand.
Right.
But being able to recognize good posture or where you would want to be if, let's say, it was super windy or you're in an environment where it's a little more dangerous, an environment where you want to have better balance, this would be where that balance would come from.
It's almost like a magic trick or something. So Kaitlin, talk about what movement is. We've been talking about activities, we've been talking about exercise. Can you talk about those, how you would make those distinctions as they relate to your work?
And physical activity tends to be used as this umbrella term that captures all our different types of movements. The term exercise is typically reserved in research for more intentional, structured activities that people want to engage in for health reasons. Whereas physical activity can include everything from walking the dog, doing the dishes, running your errands, and running a marathon.
And they all have benefit.
Yes, exactly. There have been randomized clinical trials showing things like Tai Chi, as well as cardiorespiratory work, as well as dance, seem to show benefit for cognitive outcomes. So I'm not convinced yet that there's a movement that doesn't help the brain at this point. It's just a matter of fitting it into your life.
Exactly, Kaitlin. Like, I love that. And I think that that needs to be screamed from the rooftops, because so many people have this idea of what the perfect exercise regimen looks like because it's kind of being sold to them. When really finding what it is that you like to do, what your body enjoys to do when it comes to movement is, I find, the only real way to have a sustainable practice. And that's going to look so different from one person to the next. So to hear that coming from the scientist, that movement, all movement really counts, is huge.
So Mollie, can we take these concepts that you've been showing me and now apply them to walking?
Such a simple ask. So this idea of the pelvis being over the feet is kind of what connects a lot of what we've been talking about today. And that doesn't change even when we're moving. The thing that changes when we're moving is that we're moving in space.
Yeah.
So staying in a statically stacked position no longer works. When we're walking, we need to make sure that our pelvis stays ahead of our feet. If our feet get ahead of our pelvis, we're gonna end up falling backwards. I want you to walk, and I want you to think about being in front of yourself as you walk.
Being ahead of myself. Okay, got it. Try it?
Why not?
Okay, here goes.
This is how we learn.
Okay. So, just being ahead of myself. I feel in control. I feel stable, even as I'm moving through space.
Most of us walk behind ourselves. If we are exercising, if we are going for a walk with the intention of helping our bodies,
Right.
walking forward of ourselves allows gravity to keep our body in better alignment. So that's strengthening our locomotive muscles for alignment's sake, for exercise sake, whether this is walking, jogging, running, moving forward intentionally with the forward movement is going to make it a lot simpler on your body.
It's funny, you said intentionally, and intention was the word that was in my mind.
Yeah.
It was like, it's moving with intention, with thought. Mm-hmm. And
The body follows.
yeah, it's like the power of the brain somehow.
Kaitlin would be so proud of us.
I know, I know. But yeah, using brain power, using focus to align myself better, even as I'm moving through the world.
Especially when you're moving through the world.
Especially as I'm moving through the world. And it feels also like something where if I practice it,
It becomes more and more
it
familiar.
becomes more and more familiar, more of a habit.
Yes.
And then when I get to a point later in my life where maybe I'm not as strong or not as stable in some ways, that this will help me to remain as safe and in control as I can be.
Completely, particularly when we start using any kind of assistance, whether it's things on the wall, stairwells, or whether it's a walker, whether it's a cane. If we are used to feeling this balance, that extra support will be there to support us and won't be something that sneaks up on us. So all of this is preventative movement, preventative healthcare. And without knowing a ton about the anatomy, right? What did we learn today? We learned where our hips are.
Yes.
And then we took that.
Which was mind-blowing, by the way. It was like, really did not see that coming.
we took
Didn't
that.
even know I didn't know it.
We took that awareness and we stacked it up over the chair,
Yeah.
then we stacked it up over our feet, and then we stacked it in motion.
Yeah.
So one little piece of anatomical awareness, anatomical embodiment is huge. It makes a profound change on the way that you change levels, on the way that you move through the world.
This is a great start. I feel like
Wonderful
this is
start.
a great beginning, and I'm just so grateful that we have spent this time together. I have learned so much.
Always a blast, Josh.